From the Valve Institute at Manatee Memorial Hospital in Bradenton, Florida, we will be discussing a case with a novel approach to the repair of an anterior mitral leaflet cleft using a MitraClip. The MitraClip is traditionally used for the repair of severe symptomatic mitral regurgitation, a problem often seen with degenerative mitral valve disease in the elderly population. This technique was first approved by the FDA in the United States in just 2013. The distinguishing aspects of this case include not only the procedure technique that's used, but also this patient's presentation. Her cardiac history revealed the incidental discovery of a congenital osteoprimum defect at age 60 when she was being worked up for paroxysmal atrial fibrillation. 10 years later, after failing multiple medications, she opted for an ablation procedure and at the time agreed to closure of her atrial septal defect as well as her left atrial appendage. Review of her records does not even discuss a cleft, which is normally seen with this congenital abnormality. It does, however, note that her mitral valve function was normal at this time. The patient reports living a healthy lifestyle and being symptom-free for the next 3 years, when at the age of 73, she presented to us with shortness of breath and fatigue with even minimal exertion, which was significantly impacting the quality of her life. An outpatient transthoracic echo revealed the presence of severe mitral regurgitation compared to the imaging that was done just 3 years prior. Follow-up transesophageal echo demonstrated that this regurg was 4+ with a large posterior regurgitant jet, and at the time her right ventricular systolic pressure was elevated despite her age and accounts for some of her presenting symptoms as well. However, her ejection fraction was preserved, which made intervention a favorable option. So the case was reviewed by the heart team as well as discussed in depth with this patient, but given her advanced age, prior cardiac surgery, and elevated surgical risk, the decision was made to proceed with percutaneous transcatheter repair as opposed to surgery, and she was admitted to the hospital. The advantage of using the MitraClip is not having to open the chest wall and accessing the vein through a small cut, which means decreased wound infections, blood transfusions, the use of mechanical ventilation, and decreased length of stay. Length of stay is typically overnight, with the patient getting to go home the following day as opposed to a facility, as was the case with our patient who was eager to get back to her active lifestyle. For the procedure, the catheter was advanced into the right side of the heart, crossing the atrial wall to the left heart to gain access to the mitral valve. The distinguishing aspect of this case was using a single mitral clip to return the congenitally abnormal valve to a predominantly bileaflet appearance with trivial residual orifice because of the placement of the clip. The clip was between A3-P3 since mitral clips are designed for edge-to-edge repair of leaflets. There was concern that by placing a clip between the scallops across the cleft, that it may further distort her anatomy. After placement of a single mitral clip in this case, a successful result was achieved, and in this innovative approach, the valve is left with essentially a single orifice, and the patient was noted to have almost immediate clinical improvement. One other case was reported back in October of 2020 in the Journal of American College of Cardiology case reports, in which 2 clips were used, one of which was placed across the scallops of the cleft. And given the diverse anatomy of this congenital abnormality, we feel that the versatility of the MitraClip should be an option for future leaflet cleft defect repairs. The example presented by this report demonstrates that successful outcome, and furthermore, this approach, by using the MitraClip to turn what essentially appears a trileaflet cleft into a functional bileaflet valve, may have considerable practical and economic advantages over open repair and should be considered the intervention of choice going forward.